a knee x-ray today, but with 5 views. I'll be doing the AP, the lateral, the internal, the Camp Coventry, and the tangential projection. So first what I want to do is I want to go ahead and get my room all set up. I want to make sure that my CR is detented. I have my film inside the actual already ready to go. So let me go ahead and get my patient. Cameron? Hello.
Hi.
Cameron, my name's Elsa. I'm from the X-ray department, radiology department. How are you today?
Good.
Okay. What's the reason for your visit today?
I fell off my bike, landed on my knee.
Oh no. So Cameron, can you just verify your first and last name and date of birth for me, please?
It's Cameron Gerber, 7/14/1989.
Oh, okay. And Cameron, is there any possibility you might be pregnant?
No.
No? Okay, sounds good. Alright, Cameron, so I'm going to go ahead and have you sit on this bed for me, please. And I'm going to have you facing up. So lay down on your back. So you have the patient laying on his back. I want to make sure that I shield him. And the x-ray that we're going to be doing is going to be on his right knee. So you always want to raise the patient up because you don't want to mess up your back. So you have it up. For the AP on the knee, you want to make sure that you angle the machine from 5 to 7 degrees. Okay, so now we're going to go ahead and do an AP on the knee, which you want to make sure that you center 1/2 inch below the patella apex. You want to make sure that you have your machine 3 to 5 degrees angled in. You're lined up. You want to make sure that you collimate on the knee. And also, you put your marker in the light field. Go ahead and take a deep breath in, sir. Blow it out. Take the exposure. Beep. And for this exposure here, you would normally do about 75 to 80 to about 8 to 10 masks. Now for the next one, you go ahead and change your cassette. You get a new one in. You go run this one. Put the new one in. Alright, sir, and we're going to be doing the medial next. So what I'm going to have you do is I'm going to have you just go ahead and rotate your leg in. You're rotating the leg about 45 degrees on the knee. Once again, you want to make sure that you have this 3 to 5 degrees angled. You center 1/2 inch below the patella. So, there you go. Make sure that your marker's in the light field. You collimate both sides. You leave your exposure at the same. Alright, sir, go ahead and take a deep breath in. Hold it. Beep. And for the next one, you go ahead and grab a new cassette. You exchange the cassette out. But you also want to make sure that you have the patient lay on the affected side. So with that, sir, if I can go ahead and have you go ahead and turn to your right side. Perfect. And then go ahead and bring your left leg over. So I'm going to do a little bit of a yoga pose here for you. Bring your leg up here for me. All the way up. There you go. I'm going to help you out here. Make sure I shield him. Now with this here, you want to make sure that his epicondyles are perpendicular to one another. So you want to make sure that his leg is not overly rotated out or in. So with this here, it looks really good to me right now. So you also want to give it a little bit of more of an angle. So you want to go anywhere between 5 to 7 on this. So you go 5 to 7. You also want to make sure that you're lined up. So you get lined up and then you go ahead and center. And now I will be shooting the actual lateral view of the knee. you want to make sure that the epicondyles are perpendicular to one another, and you center 1 inch medial of the medial epicondyle. So also too, because you do make a slight change on the degree angle on the machine, you go from 5 to 7 on this one. You want to make sure that you're lined up to your cassette or to your film. So with this, you line it up right there. So you line it up, collimate, put your marker in place, and also want to make sure that his epicondyles look parallel to one another. Make sure that his foot's not medially rotated in or out. Everything looks good. For this one here, you do increase the technique. I would go about 80 at 10, just because it's a lateral view. Okay, sir, go ahead and take a deep breath in, hold it, shoot the exposure. Go ahead and grab my disc and go run it. Okay, so now I will be shooting the Houston and the Camp Coventry method. But the first one that we're going to do is going to be the Houston method. You want the patient to be prone. As you do this, you want to make sure that your patient is not rotated due to the fact that his knee will be it's going to be resting on my CR, but before you do that, you want to make sure that it's not hot. So once you do that, you want to go ahead and get the patient's leg. You want to flex it so it's resting on the machine. And for this, you want to go ahead and put your CR, you want to angle it right at the patellofemoral joint. Once you have that there, you want to make sure that you collimate. Make sure you place your marker. For this shot, you would use anywhere between 65 at 1-2, because you're not going through much, you're just going through the joint. Okay, sir. Go ahead and hold that position. You shoot. Okay. Go ahead and rest your leg. Go ahead and grab this. Then I'm going to go ahead and take this one, run it, come back, grab a new cassette. The next one I'm going to be demonstrating is going to be the Camp Coventry, which the patient's already in the prone position. The one thing that you're going to do is you're going to make sure that you flex the patient's leg about 40 to 50 degrees. And I will be using this cone here to go ahead and rest his foot on there. One thing that you need to have the machine perpendicular to the lower axis of the leg, and you will have to have the CR entering the knee of the joint, which I will go ahead and demonstrate for you. So starting there, go ahead and angle this, grab it up, pull it over to the correct side of the patient. Want to make sure you angle it about 40 degrees to the lower axis of the leg. You want to make sure that you put the cassette under the patient's leg, and then go ahead and rest your leg there, sir. Thank you. So once you have it all centered, you cone in, put your marker. And for this technique, I would use anywhere between 65 to 70 at about 4 to 6 mass. Tell the patient to go ahead and hold the exposure, shoot the patient, beep. And then once you're done with this one, you can go ahead and have the patient unrest his leg from the cone that you put here. Go ahead and run your last film, and that is how you shoot the right knee. Okay, so this is the actual cassette, the reader that you would come to. I would go ahead and look for my patient's name, make sure that I open the exam, and mark down the actual images that I'm going to be shooting. Once I go ahead and get my images x-rayed and taken on my film, I would go ahead and scan it, and then go ahead and run it in the cassette reader. But that's how you would read your cassette. And then once you're done, you go ahead and suspend it, and it goes over to DICOM. And I'll be evaluating the images that I took of the knee, as well as for critiquing them for you and letting you know what we look for. First, we'll go ahead and start off with the AP knee. There's a few things that you want to make sure that you do. You want to collimate to the field that you're going into. If the patient does happen to have a prosthesis or anything, you also definitely want to make sure that you get those. You don't want to cut them out because otherwise that will cause you to repeat. You want to make sure that there's no rotation, that the patella is completely superimposed to the femur, and that the knee is fully extended. That's with, the patient being comfortable doing that. And let's see, now we're going to go into the AP oblique of the knee. With this here, you definitely want to make sure that you collimate as well. They could have gone in just a slight bit more. But overall, you want to make sure that you have the knee joint to be opened. You want to have the tibial plateau should be showing as well. And you want to have the fibula superimposed over the lateral at the very end. So that's how you'll know that it's a complete oblique. Moving along, now we will be going over the lateral of the knee. This one here, you definitely want to make sure when you're collimating that you collimate with care, because the patella does hang out towards the end, and you don't want to cut that, because if you cut that, then you'll definitely have to repeat. You want to make sure that the femoral condyles are superimposed with each other. You want to make sure that you have open joint space between the femoral condyles and the tibia. And you're obviously going to notice that the patella is in a lateral profile. With this, you want to have the patient try to flex the knee in order for you to be able to get all of this open, roughly about 20 to 30 degrees. If they can't do that, then you can try other techniques, maybe having the patient do cross table, or just make sure that you're at the patient's comfort at this point. The next one I'm going to show you is going to be the Camp Coventry method. Once again, you want to make sure that you collimate, with care for patient. You want to make sure you watch that patient doze. You want to have no rotation. This one here is definitely going to be looking for the open fossa. And you're going to notice that the apex of the patella is superimposed with the femur up here. So you're not going to be able to see that clearly, but this is definitely what we're looking for here, and this open joint space. Next one we're going to go over, it's going to be the Houston method. This one is going to be pretty much looking at the patella. So that's where you have the patella in profile. You have the patella joint space open here. You also want to make sure to open the patellofemoral articulation, which is there. And once again, you want to make sure you collimate, mark your stuff, and always make sure that the patient is comfortable and willing to do these projections, because for the Houston and the Coventry, the patient is laying prone. So that's one thing that you definitely want to make sure that the patient is able to do so. And that would be it for critiquing my images. Hope you enjoyed, and thank you.